In this section, we're going to look at something we call the SACM definition of addiction. Now, SACM stands for the American Society of Addiction Medicine. That's this big group of doctors that sort of oversees our field. And they issue a formal statement on addiction that turns out to be a gold mine for understanding what clients get in treatment as far as chemical dependency education. And because we want you to become an educated consumer by learning everything that your client is learning, this SACM definition is a really valuable piece of information. At first glance, a lot of people aren't going to realize the significance of some of the particular words used in this short little statement. So what we're going to do here is break this down sentence by sentence and analyze some of the key words. This is going to give you a good idea of just how important this can be from the perspective of helping clients understanding exactly what their problem is. And later on in the course, we're going to see how this ties directly into helping them become more motivated for recovery. Okay, so first sentence. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. So the first word we're going to focus on here is primary. Addiction is a primary disease. That means nothing else caused it. Using drugs is what causes addiction. It's the repeated use of mood-altering substances that leads to the rewiring of the circuitry that they're referring to in the second half of that statement. So right there, that brings up an important point with regard to what causes addiction. It's not bad parenting that causes addiction. Depression doesn't cause drug addiction. Trauma, peer pressure, none of these cause drug addiction. Using drugs is what causes drug addiction. Now, that's not to say that issues like these don't contribute to drug use, but it's important to make the distinction that what's happening with these kind of issues is that they create greater benefit for getting high. So, for example, say a client has severe emotional wounding. And if getting high provides relief from this wounding, there's going to be a significant benefit from getting high. And the user is going to be inclined to use again, and again, and again. And what causes drug addiction? Using the drugs is what causes the addiction. Some parents are keenly aware of their child's emotional pain and what caused it. And it's understandable that they might think that addressing those issues is more important than addressing the drug use right away. And it sometimes takes a little while for us to help them understand that a major part of drug treatment is addressing those underlying issues. But the reason for addressing those issues is in the context of reducing the benefit that using provides and taking away that reason to use. A second part of this primary aspect is that any other problem related to the primary problem cannot be effectively dealt with until you arrest the primary problem. So a really clear example. It wouldn't make a lot of sense to treat cirrhosis of the liver with an alcoholic who's still drinking, right? Or a little closer to home, substance use usually causes family problems, right? But going to a family therapist to talk about communication or trust issues isn't going to be real effective until the substance use is addressed. The problems are going to continue as long as the drug use continues. Now, the real area where there can be some confusion around this primary aspect is when there's other mental health issues present. The important thing to remember is that you can't effectively treat depression or other mood disorders if you don't have a level playing field. And drug use really messes up the playing field. You've got to get the drug use out of the way. But that's not to say that these issues aren't important. More realistically, what happens is these issues are treated as what we call co-occurring disorders. We treat them at the same time. The important thing here is for parents to keep in mind that addiction is identified as a primary disease. If substance use disorder is diagnosed, it's got to be treated.